Hello, and thank you for joining us today as we learn about diagnostic practices for antibiotic resistant gonorrhea. This training is provided by the Wisconsin Department of Health Services, or DHS, and developed in partnership with Healthcare Education and Training. Through this module, you will learn what antibiotic resistant gonorrhea, or ARGC, is and when to suspect it among your patients. You will also learn how to access specimen collection kits and transport samples to the Milwaukee Health Department Laboratory at no cost to your jurisdiction. Finally, you will learn how the lab will use those samples to assess for ARGC and what your next steps should be. Gonorrhea is a common sexually transmitted infection, or STI, and infections may be located in the genitals, rectum, and/or throat. Most people who acquire gonorrhea will experience a routine infection. These cases will be easily treated by recommended antibiotic regimens. Untreated or unsuccessfully treated cases of gonorrhea can progress to more serious illness. Neisseria gonorrhoeae, the bacteria which causes gonorrhea, has developed resistance to many antibiotics. ARGC is present when recommended antibiotics aren't successful in clearing the infection. This can make gonorrhea treatment complicated. As rates of ARGC have risen, the Centers for Disease Control and Prevention, or CDC, has allocated funding to state and local health departments to respond to this emergent threat. To address ARGC, the CDC launched a program formerly known as the Strengthening the United States Response to Antibiotic-Resistant Gonorrhea, or SURRG, project. The program, formerly known as Wisconsin SURRG, works to expand access to ARGC testing services, enhance capacity to identify potential cases of antibiotic-resistant gonorrhea, and develop plans to guide state and local responses to ARGC. The work done here in Wisconsin and at the other 7 sites around the country who are fighting against ARGC has been instrumental in identifying necessary changes to STI treatment recommendations. The CDC updated the STI treatment guidelines in 2021 after several sites found widespread antibiotic resistance to the prior first-line gonorrhea treatment, azithromycin. The CDC now recommends first-line treatment of uncomplicated gonorrhea with 1 dose of ceftriaxone, an injectable antibiotic of the cephalosporin class. In Wisconsin, the early years spent working to combat ARGC were centralized in the city of Milwaukee. This was because the rate of gonorrhea infections tends to be higher there than in the rest of the state, and because the Milwaukee Health Department Laboratory has a strong capacity for high-volume STI testing. The Milwaukee Health Department Laboratory has been instrumental to the fight against antibiotic-resistant gonorrhea, serving as the statewide Center of Excellence for ARGC diagnostics. Specifically, they are a hub for enhanced gonorrhea and ARGC testing services and innovations in the state. As a center of excellence, the Milwaukee Health Department Laboratory offers testing services for antibiotic susceptibility testing, or AST, at no charge for clinicians and local or tribal health departments throughout Wisconsin. The earliest way to identify ARGC is by monitoring patients for suspected treatment failure, STF. This can be suspected if symptoms persist 3 to 5 days or more following CDC-recommended treatment. Additional testing will help one to understand why the infection has not been successfully treated and if ARGC may be suspected. Healthcare professionals are also advised to bring patients treated for gonorrhea back for a test of cure, TOC, 14 days or more following treatment to help identify instances of STF. particularly if the patient was diagnosed with pharyngeal gonorrhea, is reporting persistent symptoms after treatment, if the patient had anogenital gonorrhea and did not receive CDC recommended antibiotic regimens, or if the patient has positive lab results showing reduced susceptibility to recommended antibiotics. Culture-based testing is the only reliable way to test if bacteria have resistance to recommended antibiotics because these tests allow for antimicrobial susceptibility testing. Nucleic acid amplification testing, NAT, is useful for determining if a person has gonorrhea but cannot currently indicate if the form of gonorrhea a person has will be resistant to treatment. To identify patients with ARGC, you must perform antimicrobial susceptibility testing using the e-test method. Currently, the Milwaukee Health Department Laboratory is the only clinical laboratory in the state that performs both culture and e-test of Neisseria gonorrhoeae, though some clinics may work with out-of-state labs to perform susceptibility testing of samples. Before we move on, let's do a knowledge check. Question 1. True or false? My jurisdiction only has access to NATs for STI testing. This is all that I would need to tell if my patient has antibiotic-resistant gonorrhea. This statement is false. NATs can tell you if a patient has gonorrhea and can confirm if treatment was successful in clearing the infection when brought back for a test of cure. Unfortunately, these widely available tests cannot tell you if the form of gonorrhea a patient is infected with has reduced susceptibility or resistance to antibiotics. Only culture and antimicrobial susceptibility testing can do that. Question 2. When might an antimicrobial susceptibility test, AST, be most appropriate? Choose all that apply. A. Every case of gonorrhea should get AST. B. If the patient has been correctly treated and is still showing symptoms. C. If I performed a test of cure and the patient is still testing positive 14 or more days after treatment. D. If the patient reported new sexual contact since treatment and is reporting symptoms. Both B and C are correct. Persistent symptoms about 3 to 5 days after being treated with CDC-recommended regimens or a positive test of cure could suggest reduced susceptibility or resistance to antibiotics in certain circumstances. The following section will outline the process for seeing if patients will need AST and the process for getting these services at no charge to your jurisdiction or clinic. The first step to access AST through the Milwaukee Health Department Laboratory is for staff from a local or tribal health department or healthcare provider to notify Wisconsin DHS by submitting a case report form in WEDS. Clinicians must report any cases of suspected treatment failure to the clinician's state or local public health department within 24 hours. Following that report, contact the epidemiology coordinator for consultation at DHS DPH ARGC at dhs.wisconsin.gov. The epidemiology coordinator will determine eligibility for testing services, advise on specimen collection for test of cure, also called TOC, and alternative treatment decisions, and help to guide the rest of this process. Each consultation will be unique, but in general, providers who are eligible for testing services have patients who have tested positive for gonorrhea and have a clinician's order for cephalosporin AST, tested positive for gonorrhea and have suspected treatment failure, are suspected of having a disseminated gonococcal infection, reside in a jurisdiction, or are seen at a clinic that does not have access to culture testing or AST. The epidemiology coordinator will connect providers to the Milwaukee Health Department Laboratory. Eligible testing will be available at no cost and will not be billed back to the requesting laboratory, clinical provider, or patient. The Milwaukee Health Department Laboratory will assist in the next steps. This may include collecting provider information, arranging logistics for the delivery of specimen collection materials, coordinating courier service to transfer the sample to the Milwaukee Health Department Laboratory, and providing antimicrobial susceptibility results back to the requester. Cultures that have reduced antimicrobial susceptibility will be sent to the CDC for additional confirmation or genomic analysis. In this section, we will describe options for sharing either an isolated culture or patient samples with the Milwaukee Health Department Laboratory, what's included in the specimen collection kit, how to correctly handle collection materials, what the included paperwork will look like and how to fill it out, how to package and store the kit for transport back to the Milwaukee Health Department Laboratory. If the requester has access to a gonorrhea isolate cultured at a clinical laboratory rather than a patient specimen, pure isolates can be subcultured to a chocolate agar slant and transported at 2 to 8 degrees Celsius. Alternatively, frozen isolates can be shipped to the Milwaukee Health Department Laboratory on dry ice. If a requester does not have a pure isolate, the Milwaukee Health Department Laboratory will send a specimen collection kit with all required supplies for collecting and transporting a patient sample. The kit will contain an e-swab appropriate for the type of collection being performed. The Milwaukee Health Department Laboratory accepts e-swab specimens collected in a clinical setting either by the healthcare provider or by the patient under supervision of the healthcare provider. When it is time to collect the specimen, remove the swab from its pouch carefully. Only handle the part of the swab applicator shaft above the breakpoint indication line. Collect the specimen from the appropriate anatomical site. Each e-swab comes pre-packaged with a tube of liquid medium, which stabilizes the specimen for transport. Immediately after collection, insert the e-swab into the tube and break the swab at the red-marked breaking point. Be sure to hold the tube away from your face. Discard the broken handle part of the swab shaft following your facility's disposal practices. Replace the cap on the tube and secure tightly. Throughout this process, ensure that the liquid medium within the tube is not spilled, as it is necessary for specimen stability. The e-swab or isolate container must be labeled with the patient's name, date of birth, date and time of collection, and anatomical site of collection. Failure to include this information may result in the specimen being rejected for testing. All patient and clinic information should also be provided on a completed Milwaukee Health Department requisition form. It's important to remember to check the boxes in the lower left corner marked Wisconsin DHS Use Only. Your collection kit will also include a biohazard specimen bag with absorbent material inside. Please do not remove the absorbent material from the bag as it protects against leaks during transit. Place the collected specimen in the zippered pocket of the provided biohazard specimen bag, along with the absorbent pad. Place the completed Milwaukee Health Department requisition form with all necessary patient information into the outside pocket of the specimen bag. Do not place the requisition form in the zippered pocket along with the specimen. Once it is appropriately packaged, place the specimen in a well-marked refrigerated location for pickup. The Milwaukee Health Department Laboratory will work with a courier to arrange pickup and ensure that the specimen is transported to the lab promptly. Because e-swabs are acceptable for only 24 hours after collection, the Milwaukee Health Department Laboratory must receive specimens Monday through Thursday. It is critical to work closely with the Milwaukee Health Department Laboratory to coordinate specimen collection and pickup times prior to seeing the client or patient. Let's do a knowledge check. Question 1. True or false? In every circumstance, I should just send samples directly to the Milwaukee Health Department Laboratory. The correct answer is false. Not every circumstance requires AST, and so you should first consult with Wisconsin DHS's epidemiology coordinator at DHS-DPH-ARGC at dhs.wisconsin.gov. They will then work to connect you with the lab if appropriate. Question 2. Of the following, which may be used for AST? A. Patient specimens collected with an e-swab from the Milwaukee Health Department Laboratory. B. Isolates cultured at a clinical laboratory subcultured in a chocolate agar slant. C. Frozen isolates. D. All of the above. The correct answer is D. Patient specimens collected with e-swabs from the Milwaukee Health Department Laboratory, isolates cultured at clinical laboratory subcultured in a chocolate agar slant, and frozen isolates can be used for AST. Question 3. True or false? Patient samples collected with an e-swab are generally stable for only 24 hours after collection. The statement is true. Because of this tight window, it is important that specimen collection is scheduled on a Monday, Tuesday, Wednesday, or Thursday so that the Milwaukee Health Department Laboratory has enough time to process the sample for testing. In this section, you'll learn more about how the Milwaukee Health Department Laboratory performs AST, including depictions of unpacking a sample and performing initial confirmatory tests for gonorrhea, the e-test process for AST, receiving results from testing. After confirming that all necessary information has been provided on the sample and requisition, and that all details match, the e-swab will be cultured and incubated for at least 24 hours and up to 48 if necessary. Initial testing is then done to quickly identify samples that do not contain gonorrhea so that providers can be notified. If a plate does not show growth or the growth does not react to the gram stain and oxidase, then gonorrhea was not isolated. If initial tests suggest that the isolate is gonorrhea, MALDI-TOF is used to confirm species-level identification, meaning that the result will confirm that the bacteria is Neisseria gonorrhoeae and not another related species. Once Neisseria gonorrhoeae has been confirmed, e-test is performed on confirmed isolates to assess for antimicrobial resistance. E-test is a culture-based method of testing gonorrhea isolated from an individual patient against a variety of different antibiotics that could be used to treat their infection. The Milwaukee Health Department Laboratory tests for resistance to the current CDC-recommended antibiotics for gonorrhea treatment. After 20 to 24 hours, the e-test will be read. The number where the zone of inhibition intersects the e-test strip is called the minimum inhibitory concentration. Each minimum inhibitory concentration identified is provided on the results report, and an interpretation is assigned to each value for use by the healthcare provider. Minimum inhibitory concentrations tell you the lowest concentration at which an antibiotic will be effective in preventing bacteria from growing. Interpretations of these values suggest how effective antibiotics may be in clearing infections. From receiving the sample to completing AST, it is expected that submitters should have final results 3 to 7 days following shipping of the sample. After testing is complete, the Milwaukee Health Department Laboratory will report tests to the submitter, to Wisconsin DHS, and to the CDC. Isolates with reduced susceptibility to cephalosporins or with clinically confirmed treatment failure will be forwarded to the CDC for additional confirmation or genomic analysis. Once results are shared, Wisconsin DHS will offer further consultation and guidance for case management. To review, let's do a knowledge check. How can we test for antibiotic-resistant gonorrhea? A. Patient questionnaires. B. NATs. C. AST of cultured samples. D. All of the above. The correct answer is C. Accessing AST services starts with consultation with Wisconsin DHS's epidemiology coordinator, who can be contacted at dhs-dph-argc@dhs.wisconsin.gov. Congratulations on completing the Diagnostic Practices for Antibiotic-Resistant Gonorrhea module. You should now be prepared to monitor for potential cases of ARGC, understand how to report these cases, and request AST following consultation with Wisconsin DHS's epidemiology coordinator, and be ready to collect, prepare, and transport samples from eligible patients for testing. This work is crucial for our continued effort to prevent further emergence of ARGC in Wisconsin. Stay in touch. Sign up for our STI email list by visiting the link in the description box. Email the Wisconsin DHS Epidemiology Coordinator for questions related to ARGC or to request a consultation for a potential case. You'll find the links and resources mentioned in this video in the description box below. Effective August of 2024. The CDC has announced changes to the SURRG project. The project, formerly known as SURRG, is now Combating Antimicrobial Resistant Gonorrhea and Other STIs, or the CARGOS project. Changes are expected and funding sites may be altered. Please note that some information contained in this video may be out of date at the time of viewing.